Can you do a reverse tummy tuck with a BBL round 2 for more fat on the hips? Yes. Reverse tummy tuck is something we should be talking about, guys. So reverse tummy tuck is this surgery that it's basically like, think of it as a mini tummy tuck for your upper belly, okay? So for people who have upper belly skin laxity, maybe they had weight loss, maybe they had lipo in the past and got a little skin stretchiness, maybe they had kids and the lower belly isn't that stretched out, it's just the upper belly that's stretched out and they don't need a full tummy tuck. We can do a reverse tummy tuck, which is basically the incision goes under the breast, okay, like this. All right, and it pulls up the upper abdomen skin and it tightens up the upper abdomen skin. Now, the traditional reverse tummy tuck goes across here. I don't like to connect this if we can avoid it, and usually we can't avoid it. So usually I'm doing just a little incision, kind of, or not a little, but an incision that goes across the breast, kind of like here, hides underneath, kind of like a breast reduction or breast lift type incision. So the other part of this question. Can we combine it with other surgeries? You can combine it with most surgeries, actually. And if you have some laxity up in that area and you're going for a round 2, and you're going to have more laxity, it's a good time to do it. It doesn't really add much recovery stuff to your surgery, which is pretty awesome. And if you already have a breast reduction incision, it's basically a freebie when it comes to scars, and it just improves that upper belly. It's a surgery that is happening much more in the last year or so because of people with like GLP-1 weight loss and just more people with lipo and people looking for solutions to help tighten. So totally can do a reverse tummy tuck with BBL, round 2 for more fat on the hips. There you go. Yeah. Can you get a reverse tummy tuck with breast lift and implants at the same time? This is a more nuanced question, all right? So yes, in most cases, but tougher in some cases. Here's the deal. When you are doing a breast lift with implants, you are taking that saggy breast tissue and you're lifting it up, and an implant wants to kind of pull things down or stretch things out a little bit, okay? So that is a little bit more of a complicated surgery. And then in that same fold underneath, we want to raise up this upper belly skin, and that can be tough to do all those things and keep all that staying put right here and keep it from migrating and moving all over the place. So basically, it's going to be a little different in everybody's body. So if we have to like pull a ton of skin from your belly, maybe it's not the best, or if we have to like really raise and lift and do the breast lift, it's not the best. So like if it's an average breast lift and an average reverse tummy tuck, probably. If any one of those is like really complex or something, we may decide to two-stage it because that may just give you a better, more durable result and things aren't being pulled in all different directions. But in general, yes, you can. Here's a niche question. All right, can you have liposuction if you have abdominal mesh? Yes. So when they put the abdominal mesh in, they usually put it underneath the muscles, deep to the muscles, so to speak. So it's not sitting on top of the muscles. Remember, the layers are skin, fat, muscles, and then all your intestines and that kind of stuff. So the mesh is probably underneath the muscles. So you can totally have lipo or a tummy tuck if we're going to be doing that. Even if you get a belly button hernia repair and they use mesh, they will probably put that underneath and deep. And so we can still do a tummy tuck or lipo or all this kind of stuff, and you should be totally fine. So it's not generally an issue. All right, how long after surgery do patients stay for observation? So you're gonna think this is awesome, but it's about an hour to an hour and a half after surgery is when patients are able to get up and roll out from surgery. At our surgery practice, we use a lower narcotic protocol when it comes to surgery. So we give you less narcotics during surgery when you're asleep. It doesn't mean that you have more pain. You're not getting narked out during surgery. So that means that you usually will wake up easier and quicker and have less side effects like nausea and this kind of stuff that comes with like narcotics, right? So whereas when I was in the hospital, guys, it would take like 2 to 3 hours for people to like leave the hospital. It was crazy, dude. It would take forever. It sucked. That's not good customer service. That's not good taking care of patients. I hated it. That's why we built our own place, and we're always trying to improve what we're doing for patients. So, yeah, about an hour to an hour and a half. And we are always, and I talk to the staff, we're always all about, we never want anyone to feel like they're being kicked out. That is not how we roll. So it's not like hour and a half and you're getting kicked out. It's like, no. People are ready to go at an hour and a half, which is crazy. But in our surgery center, we've done over 500 surgeries over the last 3 years, and that's been a consistent thing, which is pretty awesome. Like we'll do the surgery, we'll drop the patient off into the PACU where the nurse is checking them out. I will go talk to the family. I'll go see maybe a patient in the clinic or just try to write a note. I come back and the patient's like gone. And I'm like, what? And they're like, yeah, she woke up. She did really good. I was like, that's crazy. But it's been working. And that's pretty awesome. And I think a lot of it is because we do a lower narcotic protocol and it goes a long way. So that's what's up. But yeah, we don't kick people out or, if you take longer, we take longer. It's like no big deal, Remember, we only do one big case per day. So that big case is like our total focus. So if that big case is taking a little bit longer to wake up, it's just the way it goes. So it's rare for someone to take longer than that. Less than 10% of the time, less than 5% of the time, I think people are hanging around more than an hour and a half after surgery. For a tummy tuck and Lipo 360, is it done with general anesthesia or half awake? Guys, general anesthesia. I do all my surgery, I was under general anesthesia. Most surgeons do it under general anesthesia, okay? You're just gonna get better results under general anesthesia, right? There are a lot of big surgeries you cannot do under local. So in a tummy tuck and Lipo 360, we are doing skin excision of the belly, muscle repair, redoing the belly button, doing a Mons lift, and we're lipoing the abdomen, the flanks, and the back, okay? You can do some skin excision with under local. You're not going to really be able to do a good full tummy tuck with it. If you do a skin-only tummy tuck, that's very old school. You're not going to get the shaping that you need, all right? You're not going to get those bomb results that people get these days. You're going to get average or half results, okay? Muscle repair, don't even think about doing that with under local anesthesia, half awake, sedation, none of that. You're cutting corners. And here's the other thing, guys. When you're doing lipo and you numb people up, when you go into areas like around the ribs around the pelvis where there is fat, if you're doing that under local and sedation, you just cannot get into those areas without the patient like feeling it. All right. So what does that mean? That means as a surgeon, you're shortchanging those areas. So like, I'll have patients who are like, have like this fat like under the ribs, or they got like fat around the pelvis, or like all these areas that did not get good lipo when they had like awake lipo before, or sedation lipo or something like that, or they didn't take as much, or not as much high volume, so not as much results. So a lot of like downsides to it. If it was better and easier, better results for the patient, easier, all this kind of good stuff, I would be doing it. It just doesn't get you as good results. You can't lipo as much. Everyone wants results. So I'm not trying to shortchange you for that. I think a lot of places that do this, some places do it and they do it fine. I'm not a big fan of it. I think a lot of the places that do it prey on the fact that people are so nervous to go to sleep when going to sleep is the safest part of your whole surgery. And they'll be like, oh, it's so much safer, and this and that. Like, guys, if you're already healthy and you're not like morbidly obese and have like diabetes and heart issues, going to sleep general anesthesia with medical clearance is extremely safe. The chance of dying is like 1 out of 100,000. The chance of you dying in the car on the drive there is probably more than on the table, right? So, and if you have like cardiac issues or diabetes, you need to get that stuff figured out before you go on to plastic surgery. You shouldn't be trying to like get some awake plastic surgery and then figure out your cardiac issues, So priorities, right? So no, man, general anesthesia, you don't want to be awake for this. You want me to do big surgery. You want me to do big results for you. So I got to put you to sleep. You're way more comfortable. I do all my surgeries under general anesthesia for the last 9 years, and over 1,000 patients. I know we're probably at 2,000 patients over that time. And everyone does good, and they go home, and it's all good stuff. So this kind of connects with the other questions that we were talking about. Are the surgeries done in a hospital or in your clinic? So we do them in our own clinic. For the first 5-6 years of my practice, I was doing my cases either at a hospital or a surgery center. And the surgery centers were like nice surgery centers that were like bougie, and they would work on celebrities or whatever, right? I just found that my patients did not get the level of customer service and care that they would if we brought everything in-house, okay? There's a lot of things. I literally wrote a big email to a patient today about like these kinds of things. So here's the deal. First is that lower narcotic protocol that we were talking about. At the hospital, it would take 2 to 3 hours for people to wake up from surgery and go home, sometimes 5-6 hours. If we finish that surgery at 4 o'clock and you're going home at like 9-10 o'clock and there's literally no reason to, that is stupid, okay? Also, in the OR, you need a team that you're kind of working with all the time to be efficient. If you're not efficient in the OR, you're on the table longer, which is increasing chances of infections and blood clots, and that's not good for you. And there's no reason for you to be on that table longer than you should be. So we work with the same team all the time. When we brought everything in-house, we were able to kind of control the whole process better. So you work with our team who cares about you as a person, and it's not just some lifer nurse that hang out there. She's doing a little ortho, she's doing a little this, and she's older. She doesn't care that you're 35 or 45 years old and you're getting your BBL or you're getting your mom makeover. Like literally, I dealt with so many nurses at really good places who did not care, and I would overhear the way they would talk to patients, and it would piss me off. And I was like, I can't do this no more. This is stupid. So that was, if that happens once, it's already pissing me off. That would happen often. You know what I mean? And it's not because I wasn't working at good places. Trust me, I was working at really good places in and around Chicago. So that's why I brought everything in-house. Now, the safety of it, if you get admitted to, when you're in the hospital, like I said, if you're on that table longer in surgery because the team isn't as good or they're not consistent, that increases your chances of blood clots and infections when you're on that table longer. And it also means that we can't do as much of the surgery that you want to because we have to shortchange it. We can't do some of those combos that some people want, right? So, and the other thing is that when you're in the hospital, There is more bacteria and antibiotic resistant bacteria in the hospital that you are exposed to. You're not exposed to that stuff in the community and in the outpatient surgery centers like we have at our place. We are accredited by Quad ASF. Quad ASF is one of the big accrediting boards that accredits these facilities. It is literally built as our playground to operate on our patients. I am the only surgeon there. I have no plans to bring other surgeons in. It's so that we could take care of our patients at the highest level. So that's how we do it. And trust me, guys, it's a lot of trouble and a lot of money to run your own place. And I only go through that trouble because we operate at a certain standard and we try to take care of patients at a certain standard that the hospitals and the surgery centers were not up to that standard, dude. So I could not do that. I did that for a handful of years and I was like, I cannot do this for 20, 30 year career. No way. So that's why we built our place. And, if you look at our real self, we have we're almost 300 5-star reviews in there and people talk about this experience. So we highly value customer satisfaction, care, and treating people with dignity, respect, and all this kind of stuff, right? Safety, obviously, as well, right? And the other thing is a lot of these surgeries, they're all outpatient surgeries. In my 3 years of fellowship that I did in New York, these were all outpatient surgeries. Everyone went home. In my 9 years of practice, sending thousands of patients home, they did fine. There's no reason to keep people in the hospital for these surgeries. Not all plastic surgeries, but the way that we do things, the protocol, the patients that we select, and that kind of stuff, So there's a lot of reasons why we would do it at our own clinic, and we went through the trouble of building at our own surgery center to do that. There's not a lot of good reasons to do it at the hospital. I understand why that's confusing or why people just automatically think the hospital is better and safer. And if it was better and safer and easier, then I would be doing it there. But I do it at my own place because I could not tolerate the low standards that were being done there and the way that my patients were being taken care of. All right, do you offer mons pubis reductions? And if so, what is the price range? So the mons pubis, just to define, is the pubic area. It's kind of like the area right below the tummy tuck incision. Usually this area is bigger or thicker because of two reasons. Either it has a lot of fat, so it's a kind of a big carpet of fat that's hanging out there, or there's sagging going on, right? So if you have not that much fat, but there's a lot of sagging going in that area, it's going to look bulky, and so we have to reduce that too. So I reduce or lift, so I will either lipo or lift the mons pubic in pretty much all my tummy tucks. Also, if you get a mini tummy tuck, we're lifting that area as well, so we're resetting it. What I find is that a lot of people need the lift, and then about a third of the people need the lipo there too. So I do that because I've seen a lot of patients that had surgery elsewhere or tummy tucks elsewhere. They come and the pubic area, the mons pubic area, is very bulky, and it doesn't look good in like a bikini or a one piece necessarily to have that area really bulky, So that's why we do that. Honestly, the price is variable. Meaning that we don't usually do just a straight mons pubic reduction because people don't usually come with just a mons pubic area that's bulky. Usually they're like getting lipo elsewhere, or they're getting a tummy tuck or something like that. So it's free when you're getting the lipo or you're getting the tummy tuck or the mini tummy tuck or all this other stuff because it's just part of the good body contour that we're trying to do. Besides that, everyone's a little bit different. So if this is a specific case, I think you just have to submit for a consult. I can take a look and we can always give an idea or a tentative price or that kind of thing. But that's it. We should be treating that during the big surgeries, the tummy tucks, the lipo, all these things, We should be noting that as surgeons and noting that to the patient and being like, look, this area is bulky. We should hit this area with lipo. Or this area is bulky, we should lift this. I'm going to lift this. I usually show patients that when we're doing the tummy tuck consult or the mini tummy tuck consult or the lipo consult. And about 2/3 of patients don't super need it and they don't really need a lot of lipo there, and that's totally fine. And we would talk about that too. But that's how I see that issue. All right, we got some BBL recovery questions. With a BBL and lipo, do we need drains? If so, for how long? Yes, I use drains. I use 2 drains through the poke holes down by the pubic area. We leave them in for about a week. We take them out at the 1-week visit. That is good for the vast majority of patients. The reason for that is that I'm usually doing high volume lipo, taking a lot off of you, a lot of fat off you so that we can have big results. When you take that much off people, they put a lot of fluid out into those areas. And so if you don't have those drains, you're gonna get a fluid collection, which is called a seroma. And that is not a big deal if you live nearby, we can just drain it, that's totally fine. But if you live out of town or live farther, it's a little more pain in the butt for you to come and for us to drain it. So we leave them in for about a week, and then we take it out. Let's get to the second part of this question now. When I have a lipo 360 and BBL, how soon after can I fly back as I'm based in New York? Okay, so we operate a lot of people from out of town, or people that just drive 3 hours back or 5 hours or whatever, right? So we talk about this. Every case is a little bit different, but we do have some ways of doing it, okay? So the first thing is 1 week. I want you in town for a week. if you're in town for a week and I can see you at 1 week, most issues we can handle and deal. And if anything's going to pop up, it's usually going to pop up the first week. If you get to the first week visit and you're all good, we feel comfortable sending you home, because a lot of anything that pops up after that we can usually handle remotely, and it's not a big thing. It's like a small thing or a medium thing or something, right? Now, how do we do things a little bit differently if you live out of town? And we'll talk about how to like fly back. If you have like a mini tummy tuck or a tummy tuck and you have 2 drains, a lot of times we'll take that first drain out in town, but I may send you home with that second drain just to be super conservative, because like I said, if we take that drain out and you get a fluid collection and you're nearby me, we can drain it. It's super easy. It's no problem. But if you are out of town, New York, you're back home, it's hard to find someone to drain you. So it's a lot better just send you home with one of the drains. That's a way more conservative way of doing things, so that you keep us in the loop. You let us know what that drain output's doing. I tell you when to take it out, you take it out, and then there's very little chance of having a seroma, and we're all good and safe, and your life is easier that way. So everyone's case-by-case basis. But how do you get back home after a BBL? Here's what I say, and those of you who have had work done by me, who are from out of town, you've heard me give this talk. But basically, you get on the plane. We do give you a BBL pillow. I don't want you using that BBL pillow generally, because it's a little bit cheating to be putting pressure on that butt. However, after a week, you get on that plane, put the BBL pillow down, you put it under the thigh so your butt is hanging off the back of it, and you lean more forward. When you're leaning forward, you're putting more pressure on the thighs and not really much pressure on the butt. Also, you can like kind of stand until most people are sitting, and then you can sit down. You don't have to be like the last person standing and stuff like that. Definitely do not do the thing that I see a lot of girls coming back from Miami doing, which is these photos started surfacing a bunch of years ago, where people were like kneeling down on the plane for the full 2-3 hours going back home, where like they put their knees on the ground and they put their head on the chair just so they can save the butt. And man, I was like, dude, that's so emotionally, like, it's like embarrassing, emotionally traumatizing. And just please don't do that. You don't need to do that. So what you do, you sit down on the BBL pillow, you lean forward, you put the pressure on the thighs, plane takes off, and that little bell goes ding around 20-30 minutes in. You get up, you walk to the bathroom. This way the blood is flowing. You kind of reset the clock on how much you could sit on the butt. You go to the bathroom for a minute or 2, 5 minutes, or whatever it takes. You come back, you sit down, you do that for, lean forward for another 20-30 minutes. You get up, you go to the bathroom again, kind of just to walk. You come, you do it again. By that point, you do that once or twice, maybe 3 times, and you're that girl who's peeing a lot on the airplane, so who cares, right? Like, literally, who cares? No one remembers that girl after like 2 weeks, right? So who cares? You gotta save the butt. So, and then you're touching down, you're fine, you're back home. I have not found that the girls who I have who travel have worse results than the ones who are around here. It's all the same results. So it does not ruin it. It doesn't mean that you want to like test it by sitting on that butt for 20-30 minutes or the BBL pillow, but it's okay to go back. That one little trip is not going to make a problem or a difference in your results. So when we do it all the time, people fly in, you would want to stay for a week, like I said. How soon after BBL can I go back to work? Okay, so this is a good question. It's a little different for everybody. It depends on, is your work very active? Do you have a desk job so it's low key? Is it, can you work from home? Or do you have to sit a lot, right? So you should take 2 weeks off if you're doing a BBL, at least in my hands or with our practice. If you do a little lipo and you don't have much results, then you can take 3 days off and go back to work, but you ain't gonna have much results. We're trying to get you big results. So you can also, if you work from home, you can take 1 week fully off, and then 1 week you can work from home before you go back to work. That's fine. The second week, you can totally work from home. You're not going to feel like it, but you can do it if you super need to. If you can take 2 weeks fully off, that's awesome. And then maybe you can take that third week working from home. That's kind of ideal. 2 weeks fully off, third week working from home. Because remember, you can't sit on the butt for about 3 weeks after surgery. So after those 3 weeks, then you can drive to the office and go to work. That is usually good for most people. Even if you have an active job, you should be able to get back to most active jobs in about 3 to 4 weeks after a BBL. Everyone's a little bit different. It's harder if you do stuff like tummy tuck, maybe mini tummy tuck, that kind of thing. The tummy tuck's harder because of the muscle repair. So there's some things that if you have an active job, they're harder. So it's easier if you can work from home. It's easier if you have like just a chill desk job or something. Remember, desk job after 3 weeks is good because you can sit on that butt when you go back there. So this is something that I usually talk to patients on a case-by-case basis and figure things out for them in their life individually. Everyone figures it out. We can always figure it out for everybody. But yeah, it just depends on everyone's different job and surgery. How much is BBL and Lipo 360 on average? So not just average, but we have our prices pretty set and standardized. We try to be very transparent with our pricing. We have it on our website, so I'll try to link the pricing thing here. But our Lipo 360 BBL, liposuction to full abdomen, flanks, the full back, transfer to the butt and the hips, is $16,000. It includes 5 one-hour massages, 2 body BDY fajas, a stage 1 and a stage 2, all post-op appointments, a little gift bag of like dressing and supplies, that kind of stuff, a post-surgery recovery IV. I want to include red lights in there soon, but I'll probably be doing that around week 3, week 4. It's a little bit harder. So it includes a whole bunch of stuff as well, and all post-op appointments, obviously, too. So that's it. That's what's up. Let me go ahead and include that pricing link here so you can click on that and get a feel for the range of our prices and what's included. Oh, one more point is I don't usually charge differently for round 2s or revisions. So someone comes to me for a BBL and they had a BBL elsewhere. And let's say it's a harder BBL for sure. So there's some easy ones, there's some medium ones, there's some harder ones. And honestly, they're not all easy, but there's some that are less challenging. And then it's still surgery, it's still challenging. But there's some that are more straightforward and there's some that are challenging. When it's a round 2 or a revision or challenging, and let's say I accept you to do your case as a BBL and you're getting a Dr. Azizi BBL, Lipo 360 BBL, we charge everybody the same. All those tummy tucks that are like, let's say you had lipo in the past, the belly is a disaster. I still get the same tummy tuck pricing. I do not charge more for it. We'll charge more if it's things that take more time. For example, like if we need to do an extended tummy tuck, we need to longer incision. Sure. If we need to do J plasma because that takes more time, there's a handpiece. Sure. But we try to just be like fair and equitable or egalitarian with it. I don't know what the word is, but equal with it. So if you're getting like a round 2, round 3 BBL and I take on your case, you get the same price as the round 1 person. Tummy tuck, disaster one, easy one, they're both the same price, So we just try to make it fair, kind of across the board there. Yeah. All right, we got some BMI questions. Can you get the liposuction and fat transfer with a lower BMI? What is the cutoff point? Guys, there's not really much of a cutoff point. Here's what I'll tell you. We work on a lot of lower BMI patients, do a lot of skinny BBLs. If you click on my little BBL highlight tab on my Instagram, you go through the results, you'll see a lot of skinny girls. We do a lot of BBLs on girls who are 18 to 21 BMI. I don't even worry about getting the fat on people who are 21 and 20 BMI these days. This last month, we had some of our smallest patients ever. These were patients who were 18, 19, 20 BMI, and they had lipo 360 in the past or tummy tucks in the past and like had almost no fat. And we still got a great amount of fat for them and really nice results and a big difference for all of these folks, which is awesome. It's not easy, it's hard, and there's a lot of specific technique that you need to use with your lipo, with Vaser, being careful with your cannulas. We use PRP to maximize the fat in the butt. We have a certain way of kind of like trying to get the fat out of people and talking to them about goals and like kind of what are we going to do and doing that. But we do that often. So I don't have a lower cutoff, although I find that if you're a 17 BMI, you almost certainly do not have enough fat. But it's very rare for me to tell anyone that they need to put on weight. So if you're like a 18, 19, 20, 21 BMI, just submit for the consult first, because I probably won't be telling you to put on weight. If you're like a 21, 22 BMI, 23 BMI, you are fine. So there's not really a lower cutoff. Most people fall into that. It's rare that someone's under, a 17 BMI or less. And I've done a good amount of 18 BMI people that we have been able to get enough fat and do those cases. Trust me, they're not easy. Those are hard cases. There's not a lot of guys that do really good skinny BBL, so you should do your research, because the skinny BBL people, that fat, we do not want to waste that fat. You want to lipo a good amount. You want to use all that fat and really get it in there and do not throw stuff away. And a lot of guys who are more conservative, either they don't get a lot out of you, but they lay down that scar tissue, or they don't inject a lot in you and you don't get results. So you always hear these stories from skinny girl BBLs who are like, I got a BBL and looked really good for like 3 weeks and then it all went away. It didn't all go away. Half of it went away, but the problem is they probably didn't inject enough. So if you inject just kind of a medium amount or a light amount, it's going to look like it all goes away. You have to inject a medium or a higher amount so that when that all dissolves, it could dissolve down to like a nice medium result, which is what you're trying to go for. So it usually, I find that when they have that story of like it all went away and I am able to get those op reports and see how much they injected, it's usually a very low volume amount. So in skinny girls, you have to get a lot off of them, which is hard. And you have to inject a lot back in them, which is hard. But if you can do both those things good, then you can get really nice results on these patients. And so obviously everything's case by case basis, but we really dive deep into analyzing the body, the goals, what we can do, how far we can kind of like less fat and how far we can go with that less fat basically. I weigh 200, I'm assuming pounds. Can I still get a 360? I'm guessing that's a lipo 360. If you are, it depends on your BMI. You would, for 200 pounds, you would probably have to be a 5'8", 5'9", or taller to be under a 30 BMI. 30 BMI is the limit or the cutoff at our practice. If you're 5'1", 5'4", 5'5", and 200, you would have to lose weight. Long story short, you're just going to get better results and less complications if you're under a 30 BMI. I can still do your case if you're above 30 BMI, but you're not going to get as much good results. And so everybody wants big results. And so that's why we have a BMI cutoff of 30, so that when we're doing our high volume lipo, which is a lot, it'll make the most kind of significant result, and we can get the most amount of people happy with that. If you're higher than that, that's why we got our Skinny Shot program with tirzepatide, semaglutide, and we can get people's weight down, and at a good weight, they can get their surgery and they can maintain their weight. So that's why we developed that Skinny Shot program in our place too. Do you do breast augmentations as well? Oh yes, we totally do breast augmentation. I do them all the time. Breast, tummy tuck, lipo, BBL, breast lift, reduction. That's kind of like everything. So we do breast, tummy, and weight loss surgery as well, which we'll get into some of these other questions. But stuff like brachioplasty, arm lift, thigh tuck, and the massive weight loss surgeries. Breast dogs, we totally do them. How much are breast implants? They are $11,000 at our practice. Includes the implants, obviously. I'll link our pricing again here, but you'll see. I think our breast lift price is also $11,000. I think our breast lift with implants price is $13,250. Don't quote me on it, but if you check our prices here, you'll see. Obviously includes like the implants, all the post-op appointments, or anesthesia surgery fee. The little gift bag that you get, silicone scar cream, some arnica tablets and stuff. So I'll post that right here. How much for implant replacement and a lift? So this one we do, this is going to be a little bit different case by case basis, but in general, the implant replacement with a lift, we price it similar to a breast implant with a lift. So not just that you're replacing it, but similar to like if you're just getting that implant for the first time. Usually when you're getting implant replacement and a lift, we have to do a little bit of pocket work on the inside to tighten up that pocket because it's expanded over time to kind of help push that implant towards the cleavage a little bit more. That can take a little bit more time. We don't always charge extra for that. Usually we don't, unless it's really complicated. So typically it's $13,250 is what our AugPec breast implants with lift price is, augmentation mastopexy. If you check the previous question, you'll see that I linked the price, but hey, why not link it here too? This is a good question. How much more are revisions? I'm guessing that, so you could be either tummy tuck revision or breast revision. Let's just say breast revision. Breast revision can be variable because sometimes you have to do like more pocket work, like I was saying in the previous question. How much do we charge more? If we're really going to charge more, we may charge $1,000 or $2,000 more. So we're not usually charging like $5,000 more for that kind of thing. Sometimes we have to use Galaflex. Remember, Galaflex is that internal bra. When we do that, we don't charge really extra for it. We just charge kind of like the price of the Galaflex, which is around $1,800, I believe. $1,700 or $1,800. $1,700, I think. 17 or 1800, but that's basically just the price of the Galaflex. So we just charge for that, just for like cast on the price of the cost of that. We don't upcharge it. So that's it. So if you need Galaflex, that's what we would do. If it's like a really harder revision, it may be $1,000 or $2,000 more than the standard price, but not like a $5,000 or more. Revisions of the body, like I said, are not really more. So if you don't have like some weirdo case where I can't we're doing all this kind of random, like we got to do a little this, a little that, a little this, a little that. And if it's like, we're just like lipo 360 BBL, but it's kind of revision, same price as the regular one, which is $16,000. If it's like a tummy tuck that we're doing for the front, whether it's a hard one or an easy one, it's the same price as the other ones, which is $15,000. The stuff that, like I said, stuff that costs more is like if you do have to do an extended tummy tuck, so we have to, longer incision that takes us longer to close, that's going to probably add, I believe we add only $1,000 to that extended tummy tuck price, because just to cover a little bit of extra time in the OR. So we don't really charge a ton, I would say, for revisions or more for revisions. We should still try to provide a lot of value for that. So that's just how we see things. Of course, everybody's different, and we have to just see everyone's body because every revision is going to be different. Oh, lots of breast aug questions about price. How much is breast augmentation typically, and the range? I answered in the previous question, but it is $11,000 for our breast augmentation. I believe our breast lift is $11,500. Breast lift or breast reduction is $11,500. And our breast lift with implants, if you need a lift and implants, is $13,250, I believe. So check the pricing on our website, and I linked it in a few ones before, but that's the range. All right, I love this. How long should you wait after giving birth for a consult and surgery? We usually say about 6 months. After 6 months, the body has kind of come back to its new baseline, and we have an idea of what we're going to be doing. Now, if you're trying to get surgery at like 6 months, like when's the soonest you could get surgery? Probably 6 months post having the baby. So can you get your consult at month 5 and then get your surgery a month later? Yes, that's a good way to do it, because there's not going to change that much between month 5 and month 6. Like the plan for your body ain't going to change, but we should still wait until about month 6 before we do that surgery. If you're breastfeeding, we usually want to wait about 3 months after breastfeeding is done in order to do breast surgeries. That's because the breast will come to their new baseline. There's going to be less inflammation, and so they're going to be less bleeding, and we have more accurate idea of what the breasts are going to be doing. So that's kind of what those timelines are going to be ideally. You could submit before, but I have had people who submit like 2 months post having a baby, and I just can't really give them a good plan based on what's going to happen. How long do you wear your faja after Lipo 360 and upper body lift? My faja recommendations are usually the same for most surgeries, which is you wear it all the time, day and night for the first month. You can take it off the shower and wash it. That's totally fine. And then month 2, month 3, you do half days with it. So at least 12 hours out of the day. You can choose whichever 12 hours you want. You can do 6 hours and 6 hours. It's totally fine. Some people do it during the day if they have a busy job. Some people just like to do it at night. After 3 months post-op, it depends on how much swelling you have and how much you hate the faja or you love the faja. Half the patients will continue to wear it after 3 months, and half the people will stop wearing it. But we can come to that decision together, because usually around 3 months is when I'm seeing patients. And so we can see what's your swelling like, what's your comfort level like, how are things coming along, and kind of custom tailor that decision for you. Here we go. How much is a breast lift and reduction? I did answer this, so sorry for the redundancy, but it's, I believe, $11,500. Our pricing is on the website at ramplasticsurgery.com/pricing, and I'll link that here, but I'm pretty sure it's $11,500. How soon can you return back to work post tummy tuck? Thank you. Depends on the person's job. Let's just say you have a desk job. Minimum, you need 2 weeks before you get back. You could probably get back to in 2 weeks. Can you work from home? Yes, you got to take the first week off totally. Can you work from home the second week? You can, but you're not going to feel like it, but you can if you want to. Ideally, if you're trying to minimize and kind of best combo, 2 weeks totally off, work from home on that third week. That's a good way to do it. If you have a more active job, like I've had people who are police officers or like nurses that are really pushing patients around, that kind of stuff, or like really active job, it may take you 4 to 6 weeks to get back to it after a tummy tuck so that you feel comfortable, you know? It's because it's kind of like working out. So you got to take like 4 to 6 weeks off working out. But in general, 2 weeks for a desk job, 1 to 2 weeks if you can work from home, 2 to 3 weeks is better if you have that flexibility. After a tummy tuck, how long should one be resting and how long are the drains in for? So this is going to vary from surgeon to surgeon. Every surgeon does their surgery differently, so every surgeon wants you to recover differently. The drains, we usually take them out. The first one comes out at week 1 and the other one comes out at week 2. If we're doing high volume lipo and people are putting out a lot of fluid, they may, like the second drain may take like week 2.5 or week 3 for it to come out, okay? Usually that is related to resting. So when people are chilling, hanging out on the couch, watching TV and chilling, the drains are putting out less, and so we can get them out sooner. When people start to like feel pretty good and then they like clean the house, the drains put out a ton, we can't get them out. Or people are like, oh, I'm just doing these like 20, 30 minute walks outside and their drains are pouring out a ton of like fluid and water. We can't get those out. So you gotta like chill. How long should one be resting? For the first week or two, I say like pretend it's like winter vacation, it's freezing outside, and you're just hanging out at the house, watching movies, catching up on Netflix, reading, that kind of stuff. So just chill, no house chores for a few weeks. That's the best plan. After breast lift, does the sensation in nipples minimize? Not necessarily. So the studies show that after a breast lift, the chances of having nipple sensitivity loss is about 10 to 15% in one breast. So just because you get it in one breast doesn't mean you're going to get it in both. I've seen it a couple times where people have had it in both, that they get nipple sensitivity. It can happen more often when you have like really long breast lift. Like if your breasts are down by your belly button, we're lifting that. There's more like manipulation that we have to do. So there's more chance of the nerve being injured. Or if you go with implants that are really big implants, they're stretching things a lot. I find that those people can get a little bit more decreased sensitivity in the nipples. So that's what the studies show. So, most women will be fine. 85 to 90% will be fine. And even if you get it, it's only going to be one of the breasts. Not ideal, but it's not like both of them. Some nerve sensation does come back when the swelling goes down and the nerves do creep and heal for a whole year. But it's just one of those things that is an accepted risk of surgery. Unfortunately, we have to kind of wrap our head around. Do you do thigh tucks? Totally. More people are getting thigh tucks these days because of massive weight loss and GLP-1 medications and stuff. So yeah, when we do our thigh tucks or what's called a thigh-plasty, we're usually doing lipo across the whole thigh and the inner thigh to get that reduced down and smoothed out. And we're taking a good amount of skin, kind of from the incision goes kind of down the groin and then down the thigh. Everyone's a little bit different. Sometimes if the laxity is not that bad, we can go about halfway down the thigh, but a lot of people we may need to go down to the inner knee. It's a good surgery for a lot of people. I'll give a couple of photos here of a patient that I had recently who's like, I think I took this photo 4 to 6 weeks out while she was sitting and her standing. Now, granted, when you're sitting, things look a little bit better because the skin is being pulled more taut, but it's still something that's worth showing. So I'll post that right now. Which is better for midline skin laxity, fleur-de-lis or reverse tummy tuck? All right, that's a good question. So when you have laxity in the middle here, so you have a lot of hanging right in the middle there in some people, you may have to do what's called a fleur-de-lis. A fleur-de-lis is a vertical and a horizontal excision or scar tummy tuck. So we take skin from the middle and we take skin from the bottom. Usually we'll do this for people who are like massive weight loss, lost a lot of weight. They have a lot of hanging skin in the middle. I'll see if I have a photo or a video that I can post here for that. But yeah, that's good if you have like a lot of hanging skin in the middle. Now, a lot of people do not want that vertical scar. Some people don't mind. A lot of people don't want that vertical scar. So we try to do stuff to minimize that vertical scar. These days, like I was mentioning, we can do a reverse tummy tuck where we're pulling skin underneath that breast, and that we can tighten a lot of that upper abdomen skin and hide that incision underneath the breast or right along like the top of the belly there, and avoid doing the fleur-de-lis so people can still get into bikinis and still have an awesome result. Which is better for midline skin laxity, fleur-de-lis or reverse tummy tuck? All right, that's a good question. So when you have laxity in the middle here, so you have a lot of hanging right in the middle there in some people, you may have to do what's called a fleur-de-lis. A fleur-de-lis is a vertical and a horizontal excision or scar tummy tuck. So we take skin from the middle and we take skin from the bottom. Usually we'll do this for people who are like massive weight loss, lost a lot of weight. They have a lot of hanging skin in the middle. I'll see if I have a photo or a video that I can post here for that. But yeah, that's good if you have like a lot of hanging skin in the middle. Now, a lot of people do not want that vertical scar. Some people don't mind. A lot of people don't want that vertical scar. So we try to do stuff to minimize that vertical scar. These days, like I was mentioning, we can do a reverse tummy tuck where we're pulling skin underneath that breast, and that we can tighten a lot of that upper abdomen skin and hide that incision underneath the breast or right along like the top of the belly there, and avoid doing the fleur-de-lis so people can still get into bikinis and still have an awesome result. So which is better is going to depend on people's tolerance or hate of scars. So either you have no problem with scars, and or you hate scars, or like it's a spectrum, right? So people hate them more, so people are like totally okay with them. It also depends on the surgeon. Some surgeons have a very low threshold for doing a fleur-de-lis on pretty much everybody, and some people really don't want to put a scar in the middle unless they super have to. That's me. Okay, not that I'm better or worse. It's just decision making and judgment calls. Every surgeon's different, obviously. You got to go with the one that you jive with and what you like their philosophy on surgery and stuff, right? So so I prefer, if it was me, like here's the other thing I think about, like, well, what would I want to do for my body, or what if it was my wife? I would prefer doing a reverse tummy tuck, pulling that skin underneath the breast, pulling it up, and not getting that vertical scar in the midline. Like, can you pull a little bit more skin if you do that vertical in midline? Yes, but you also have that vertical in the midline. So it's like you don't like how that skin looks, but you're trading it for a scar. So is it worthy as a trade-off? I think if you have a ton of skin, it's really lax and it's really stretchy, like a lot of hanging rolls, then a fleur-de-lis is necessary and helpful. If you don't have a ton and you can pull things up the other way, I think that's better. You can always put that scar there and take that skin in the middle if you need to, but you can't get rid of that scar if you do it there. And I do see a lot of results online where I feel like a lot of these patients did not need that vertical scar with the fleur-de-lis, and they would have done great with a regular tummy tuck. But like I said, every surgeon is different, and you just got to go with the one that you drive with and the one that you like. There's no right or wrong, I think, in this situation. But it's good to know, like, why is the surgeon doing that, or why are they recommending that? So there you go. What's your favorite surgery to perform? Oh man, this is so hard. It can vary. I'd say the top ones are like a straightforward breast aug for someone who's like an A cup and B cup, and you put implants in and you get, these larger breasts that look awesome, is so life changing, and it's the kind of thing you can't get in the gym, and it's like doesn't take that long in the OR. So to create this like life changing result for something that doesn't take that long in the OR is like amazing, right? That's pretty awesome when you have a straightforward case like that. BBL is awesome because it creates a big dramatic difference in a lot of people. It's also a surgery that I think that a lot of surgeons don't nail it, and I feel like I do it well, and so obviously I get satisfaction out of like doing it well and making a dramatic transformation in someone's body, and especially if they're feeling really good about it afterwards. Tummy tuck is fun as well because like people have some disaster bellies, and to smooth those out and make them better, I think is like a huge win. And then when combining these things, creating dramatic results is great. So I know I said a little bit of everything, but it's hard to choose. Ultimately, look, there's a lot of plastic surgery has like a zillion surgeries, especially even aesthetic plastic surgery has a bunch of them. I think what I've done is I've just narrowed my practice down to the ones that I like doing: breast work, tummy work, lipo, and fat transfer to the butt. Like, it is kind of like 3 to 4 main surgery types that we're doing. And I think that I've just aligned my practice with what I like doing. So even though that seems like, well, that's like you do that stuff. It's like, yeah, because over time, the stuff that I don't like doing, I've actually minimized or don't do anymore. So there you go. Those are my favorites. Oh man, what made you decide to become a plastic surgeon? Some of you guys have heard this story. So a couple things. My dad was a surgeon. He just retired a couple years ago at 83. So I've got 40 good more years of operating in me, I guess. So my dad was a surgeon, gynecologic oncologist. So he does women's cancer surgery, which is hardcore stuff. And I never thought about surgery or medicine, and he didn't push me one way or another. And he always said that, when you're old enough, come watch me do some surgeries, see what I do, see what you think. And I was like, all right, cool. Didn't care. I didn't really care at all for it. And then when I was 16, I went and watched him do some surgeries, and it just hit me like a ton of bricks. I was like, oh my God, dude, this is hardcore. This is amazing. And I was like, I got to do this. I got to do surgery. I have to do this. What really hit me was like how hardcore intense it is. I love the intensity of surgery. It's crazy. You're like literally cutting people open and doing all this stuff. Like, that's crazy. It's still crazy, right? But I love that. The other big thing that did it for me at that time was that you can make a big difference in someone's life in only a few hours of work. You lend 3 hours to someone's life, and you will either cure their cancer, you will change their body, you will, fix whatever, right? So that whole thing of like creating a big difference in someone's life in only a few hours, I thought was really awesome. So it's just a matter of figuring out like what kind of surgery I want to do. So I go pre-med in undergrad, I go to med school, doing a lot of different rotations, trying to figure out what I like to do. And I've actually been writing music or playing music since I was 3 years old. Played piano for many years, guitar, drums, was in bands, and then I started producing electronic music when I was in high school in the mid 90s. And DJ'd a lot and produced and played live a lot and all this kind of stuff. So the reason I like plastic surgery was that when I went and did those rotations and you're doing that shaping type work, it was very creative and outside the box type thinking that was similar to when I would sit down at like my music studio that you see back here and produce or write a song. So I felt like that creative thinking was the same as when I was writing. And I had been writing for like 15 years at this point, producing for 15 years, playing music for like 25 years or something. So like it was very much a part of me. And so I was like, okay, I love this. Number two, I love people, talking to people. I'm a people person. So it helps to be a people person if you're in plastic surgery, because it's all about like talking to people and making people feel comfortable and understanding their subjective concerns and being able to distill that into something objective, which is basically surgery and how you're going to do that surgery. So I'm a people person. I like talking to people. That makes them feel better, makes them feel heard, obviously, and like more comfortable through this whole process that can be scary, but we try to make it less scary. Cool. Also, you can do your job better if you understand people, because you understand what they're saying and you can deliver on that, right? And the other thing is that, medicine, when I got into this like 20 years ago, was starting to get worse already. And healthcare, as we know, is in a bad place right now, to say the least, right? It's like really bad. So basically, my thoughts were this, like, besides all these other things of like, the creativity I loved and like being able to make a huge difference in someone's life, awesome, and life-changing surgeries, being a people person, all this kind of stuff. My thought was that if medicine continued to go to shit, essentially, could we stay outside of the system as aesthetic private practice plastic surgeons. We could. So my dad was in private practice. I thought I would be doing private practice, and I am doing private practice. And I as soon as I finished my fellowship, I just went straight out to private practice. I didn't work at a hospital or anything like that. So I'm so happy I did that and I'm so happy I'm in this like niche field that we can stay in private practice and we can take care of patients outside of the hospital and the insurance realm, because that is such a pain in the butt, and it sucks for patients. And it sucks a lot for surgeons, and it sucks for everybody. And so to be outside of that is great, because then we can give the type of care and surgery and life-changing results for patients that they desire, and way better customer service. And so staying outside of the system was a big deal for me. And it turns out things did get worse over the course of that 20 years of my training. And so it's really nice to be outside of the system. And then you never know, like you get interested in this other stuff, like all this like biohacking stuff and wellness and optimization and aesthetic optimization stuff that's non-surgical. I didn't think I'd be interested in that stuff. And I am, which is why we have stuff like hyperbaric chamber, red lights, skin tightening stuff at our office, IV bar, post-op like massage, and all like a lot of stuff that's both aesthetic and wellness. I didn't think I'd be interested in that, but like as you go along, get interested in that kind of stuff. So that's how I became a plastic surgeon, and I think I was meant to do it. I think I'm meant to do the work right now. So it's hard to know, like, would you do it again? Well, yeah, but it's hard to know when you roll the dice again what your life will turn into. But I do feel that I am meant to do this work now through the kind of feedback I get from patients and what I'm able to do for people. So I'm like, I think I'm in a place that I should be. So whether I chose that or it chose me in life, I think we're in a pretty solid place. Can you do arm lipo under local anesthesia? You can. I'm not a big fan of it. Like I said, I do all my cases under general anesthesia because I find that they're two reasons. More comfortable for patients. You go to sleep, you wake up, boom, it's done. Easy. And if you're healthy, there's like there's so little risk with anesthesia. It's so safe. And the thing is, I just find that you can't get as good results when people are awake because they feel more of it. And that doesn't mean we're not numbing it good enough or sedating them good enough. When you're getting to some areas that are more sensitive, like around the bone or the muscle, people are going to feel that whether they're sedated, numbed up, or whatever. So you have to pull punches in those areas, and you can't lipo some of those areas as good. So that means that your results aren't as good. So I don't like doing that because I don't like being in those situations where patients are uncomfortable or we're not able to lipo as well as we want to. So that's why I don't do any of my lipo and stuff under local anesthesia. You can. There's places that do. I don't think you get as good results or as good comfort, so that's why I don't do it. All right, guys, we did it. 25 questions. I think that's the most we ever did. I don't know, it was like an hour and a half of content or whatever. So that's good stuff, man. Thank you guys so much for sending all the questions. You guys sent a bunch of good stuff, a lot of stuff I hadn't heard before. So awesome. Hopefully that was helpful and educational for everybody. Like I said before, I'm going to be taking all these guys, all these Q&As that I do, wrap them together and throw them on my YouTube. So if you want to share that with people, or you want to kind of listen to them again after they disappear after 24 hours, you can go through and do that kind of stuff. So that's pretty awesome. I think I have 15 views on my YouTube on my last one so far. So obviously it's blowing up. So go ahead and blow me up, and maybe we'll get to 20 views on this next one, guys. Thanks for listening, everybody. It's still, I'm hoping there's a little bit of sun out there so I can get out there. It's been a busy week. We've been taking care of a lot of people. It's awesome. I'm excited for all you guys. There's tons of people getting a lot of great surgeries coming up soon. We'll continue to share our rib remodeling stuff with Samantha and all the happenings at the office. But have an awesome weekend, everybody. See you guys later.